Hello, everybody. I'm Dian Griesel, also known as Silver Disobedience. And we talk about great things in these podcasts. And what we're going to look at today is AI, but in a whole new light. You can't open a single news article without somehow it's either AI is the focus or it's one of the satellite articles right around it. It's everywhere. But you know where we haven't been talking about AI? Or I'm certainly not seeing it. What about our heart health? And heart health is a big thing. We all want to be healthy and we want to keep our tickers ticking. So my guest today is an expert at this. Her name is Dr. Ami Bhatt. Since 2022, she served as the Chief Innovation Officer for the American College of Cardiology. And today, she is also chairing the FDA's Digital Health Advisory Committee. So frankly, I don't think there's anybody better we could be learning about right now about AI and digital health. Thank you for joining us, Dr. Bhatt.
Thank you so much for having me. And it's funny because we were talking about this during the Super Bowl. You couldn't get away from AI, right? It really was there. Like every commercial, immediately it was an AI commercial. So it is everywhere. So thanks for having me and focusing on some of the places where it can do a lot of good.
Now, there's so many places we could start, and these are all random conversations. But let's start with, how did you decide that cardiology has some benefits that can be gained in advancing the work with AI?
Yeah. So if you think about cardiology, we're actually, and yes, I'm a proud cardiologist, but actually it's also true of the field. We have been in the field of data, right? Numbers about your heart, of remote monitoring, right? Things like pacemakers and other things for a long time. And so we're actually a natural area where if you are already working in data, if you are already working in data at a distance, if you're already a field based in imaging, then AI is a natural next. And I will give a nod to radiology. They're all imaging and they've been using all sorts of AI, long before kind of we all got on board. And so I think that's kind of the logistic part. But then if you just think about heart disease, it is the number one killer of men and women, right? In the United States. Globally, if you take out communicable diseases, it is again the number one killer, right? And it's preventable, especially atherosclerotic disease, the plaques in your arteries that give you heart attacks, right? That is largely preventable. There are a couple genetic underpinnings, but largely there are things that we can control. And yet our incidence of heart disease continues. The number of patients with heart disease is growing because we're growing older, right? And the number of cardiologists and nurses in cardiology is steadily decreasing. So now if you say we have more disease, fewer people to take care of us, but we know how to do data and remote monitoring imaging, gosh, we're an ideal place for like the compute power of AI.
It's very interesting to me, this topic. I was on the board of the American Heart Association, the New York chapter, when the Heart Association merged with, I think it was called the Stroke Association. Yep. And they merged together. And, you talk to people, and it's fascinating to me that some people will say, well, I could handle a heart attack, but I don't want a stroke. And I'm like, whoa, you don't want either.
Yeah. No, it's true. Well, I mean, first of all, I think heart and stroke coming together made complete sense. Heart, stroke, vascular, actually, because all of that is about kind of the blood vessels, the same risk factors, a lot of the same pathways. And now you'll hear a new phrase, cardio, kidney, metabolic, CKM. And again, we're really going upstream and saying, hey, the same risk factors of high blood pressure, of cholesterol, of overweight, of other things that we can work on are leading to all of these diseases that really at end stage don't look pretty. And by the way, end stage renal disease, end stage heart disease really are just as bad as stroke and that disablement. I think some of the impressions people have of what someone looks like post-stroke, that's really, I think, over time made people really think, oh, I don't want that. But you don't really necessarily see the downstream effects of the heart attacks because they're happening in the hospital, they're happening in quiet. But now we're seeing younger and younger people actually just die of a heart attack, right? Sudden death in your 40s and 50s. And so I think unfortunately, people are now seeing the downside.
You know, it's interesting. You just made a very interesting point. My father died of congestive heart disease, but he had had a heart attack at like 62.
Mm-hmm.
And he made it till 78 when congestive heart failure took him. But we are seeing heart disease younger and younger. What, in your professional opinion, is contributing to that?
Well, it's interesting. It's not like the colorectal cancer epidemic that we're seeing, where like most certainly the diagnosis is younger and younger. When I was abroad and I was lecturing in Dubai or in India, especially in the Middle East, we're seeing absolutely heart attacks happening in 35-year-olds, right? Multi-vessel disease. And a lot of it in those areas is, partly genetics. It's partly we're learning more about different types of cholesterol that can be really bad for you that we haven't been measuring regularly. We get your LDL, your bad cholesterol, your HDL, your good cholesterol. We're not measuring lipoprotein A, which is a very bad cholesterol. And so there's a lot more that we're learning. But I think what I see it as is more of an opportunity. Like, it is not a disease of old people. I think the fact that there was no real immediate consequence of eating poorly, not taking care of yourself, not treating your hypertension, not checking your blood pressure. And now people are understanding, no, that there is an immediacy to it, and the long-term outcome's pretty darn bad. And so I think it's awareness that we need to continue raising, which thank you for, discussing this. I know you talk about leadership and a lot else on this podcast. I've been listening. I'm an avid listener, but I think part of the leadership now is recognizing that, I like to say prevention is having a glow up, right? Which is now called longevity. And I'm like, it's the same thing, guys. We want to live longer, but not just a lifespan. We want to have a health span. And the leadership part of this is, can we as a community start to, especially as cardiologists, say, we need to look upstream. We need to give patients agency to measure themselves in their community, to wear their wearables, to check their numbers, and to really start thinking about this earlier. And so there's a partnership between clinicians and patients that needs to happen, and that requires some real leadership from our side.
It's a really great point that you just made as well. You're making many great points, but one of them being, I always hear when we talk about leadership, people often talk about, oh, time is money. You got to maximize your time. Well, you know what? I think you need to maximize your energy because we all know if you have a heart attack, God forbid, or you just plain have a cold, you don't have the energy. So it doesn't make any difference how much time you have.
That's right.
And it boggles my mind how, something so essential to your life, your life blood getting pumped through your body. It's like, what do you find as a leader in this space, a thought leader who's trying to get people to think about their heart health? Where's that resistance?
Yeah, I think it's a few things. I think when you're thinking about heart health, I talked about this in my TEDx on longevity, because I was surrounded by people who were doing all sorts of kind of research on new drugs and natural ways and other things we could do in research. And I got up there and I was like, look, I can give you more years than any of these people can right now, right? I can give you up to 15 additional years of healthy life. All you have to do for me is you have to check your blood pressure. Yeah. You have to check your sugars. You have to check your weight. And I think the thing about healthcare is we've oftentimes said, well, we as the doctor take care of you. And we set it up in that way. So you go to your doctor to receive the care, and you go once a year if you make it, right? And that's actually not health. Health is continuously making good choices on a daily basis. And it doesn't mean, making the hardest choices every day. Everything in moderation is something I've always told my patients, right? Everything in moderation. Maybe sometimes there's certain things you shouldn't do at all. Valid. Right. But really important to just think about this every day. Now, the hard part is you don't want to think about it in a negative way every day. I could have a heart attack, therefore I won't have the ice cream. Like, that's not going to work for us long term. That's not scalable. But hey, I feel really good when I get a good night's sleep, right? Or I feel really good and my wearables say, I'm doing pretty well when I sleep, right? Those kind of things I think are important. And so I'm a big fan of the wearable industry. I don't think anybody doesn't know this about me, because anything that will allow people to feel that they know themselves, because we do know ourselves. We've spent so many years coming to emergency department that's busy and maybe not being heard fully. Not anybody individual's fault. Those doctors and nurses want to help. It's a crisis, right, in the emergency rooms, the system, the number of people, the speed, and you can only really take care of like the most urgent ones first. And so I think, and that's even true in a primary care office, right? We don't have as much time as we used to with our patients. And so I really want to give people agency back. And I think that's the thing. So there's not a barrier to caring about your heart. There is a lack of agency of, hey, I can do something about this. And I think that's the frame shift that I'm trying to create.
I really want to drill down on your thoughts about AI and wearable technologies to track these metabolic functions. And why I do is I almost wonder with some of the people who wear them if there's going to be a new psychological disorder that gets declared, because I see some people who wear them and I think they're very healthy with how they approach it. I see others that are like, oh my God, I didn't sleep well last night. It's almost like the fact they knew they didn't sleep well is waking their present day, even though maybe they actually slept enough, and tonight they'll get more sleep that they might need, but they're obsessed the whole day. So where do you find the balance in these wearables, which I think provide incredible benefits? I've worn in fact, I have it on right now. I've walked around with a pedometer since being on the board of the Heart Association to make sure I get my steps in.
That's right. That's right.
To my bra strap. But I know people, they get impaled.
That's so funny. So I love it. So I've tried a variety of things, right? I will say that, one thing is health-related anxiety is real, period.
For a lot of people.
Many of us have it, right? Especially as doctors, we all have it, right? So health-related anxiety is real. What I tell everybody is if you are going to either choose to use a wearable as a patient or an individual, or if you're going to prescribe it or suggest it as a clinician, right, as a doctor or a nurse or a pharmacist, you have to have the conversation. Like, is this the right person for it? Why are you using it? What is our goal with it? So I think just knowing numbers is not the goal, right? I think the goal is, why do I want this? Do I just want this to validate that some days when I don't feel great, the numbers don't look great? Okay. Do I want to wear this because I want to be able to send messages from my, wrist, and I want to be able to track my steps? Like, fine, then you have a specific thing that might work for you. Do I just want jewelry that tells me if I sleep well or not? Or, like, there's so many different things the world over. I mean, I've seen so many types of wearables made everywhere. It's not just the most common ones we see in the States. And each of them has a different ability. And I think that reminds me to remind my patients, why do you want to wear one? Like, what are you looking to do?
To ask. It's really
why am I wearing this thing? What in it do I like taking away? What bothers me when I see it too much? Wearable holidays are a real thing also, right? Like, do I need a break from it? And I really like the wearables that are a little bit more like long-term, like, I'll tell you things daily, but I can find your numbers long-term. So what I'm excited about with AI and wearables is you and I have different blood pressures. We just do. We probably have different resting heart rates. It's not what's defined by the guidelines. Yes, in range is defined by the guidelines, but we're very different. And so what I want is something that I can put on and I follow long-term, and it says, hey, Dr. Bhatt, right? Hi, Diane. This is your baseline for these numbers. And I'm noticing you're over or under your baseline pretty steadily, not just as a blip. This is one thing I teach. A blip is just a blip until it's a trend. So please wait for a trend before you have anxiety, right? So when you then see that, okay, what is happening? And this is where I talk to wearable manufacturers and I say, could you give some guidance? If you're going to tell me something, you have to link it back to a reliable medical knowledge source. You have to devise it yourself. You have to link to something that really tells you what is this. And as wearables move into healthcare, we should probably have a telemedicine clinician for the ones that are not just, there's, hey, I'm getting interesting information about myself from, whatever I'm wearing on my wrist. Then there's, hey, I'm seeing signal of me different than my baseline, whether it's my sleep, my heart rate, something, right? And that should come with information. Let me teach you something. The wearable app should teach you something. And then I think something's wrong with you. Now, generally, most of those are kind of FDA cleared algorithms, right? Or things that are more advanced. But if you're going to say something might be wrong with you, you should see someone. I do think that then there should probably be the immediate availability of someone with a skill set who can address that, and then connect you back into your healthcare system or to a new healthcare system if you don't have one. And so that's where I think AI and wearables fits together, right? Is really like personalized care.
Yeah. Those are incredibly excellent points. And the idea between a blip, a signal versus a trend. It's like when somebody says, well, the doctor wants me to get an EKG. I'm like, you're really lucky you've got a doctor who wants to give you an EKG. Have you ever had one? It's a good thing to have a baseline of, so you at least know what your heartbeat looks like compared to everybody else's, and you know what your normal is. Because as you said, your normal for anything may be very different than what somebody else's is, but without knowing that baseline and where you're deviating from. So that's a really great point you made.
Thank you. I think ECG is interesting, by the way, since we're talking about AI and cardiology and healthcare.
Yeah.
It turns out now you can tell all sorts of things from an EKG that you wouldn't imagine. So we can't tell you if your heart muscle is weak necessarily from an EKG. We can tell you about a heart attack. We can tell you a few other things. But the AI can do that now. But that same group who did that can also tell you about liver disease from an EKG. Yeah, I was recently at a conference, and I was going to put that liver disease thing up in the slide deck the next day. Then I saw how much everybody at the conference was drinking the night before. And I was like, you know what? I think I'm going to take this one out of the talk for tomorrow morning. This might scare some people. But so I think that's the part of trust in AI, though, that's really important to recognize is we're not ready yet to hear AI say, hey, this is something completely disconnected that you never would have guessed. You should trust me. I don't think humans are ready, right?
I had woken up about 3 years ago after 2 back-to-back concussions, 4 weeks apart.
Oh,
yeah.
Goodness.
Call me coordinated, and I'll answer. Or uncoordinated, I should say. But after going to a bunch of audiologists and having them say I had sudden sensorial neural hearing loss, I had gotten all these 3 different opinions, and I took it and I said, I'm just going to white out my name, white out any identifiable things, and run it through. I think it was Grok. Well, let me tell you, I got back this report that when I went to the 4th audiologist just to say, and then to the acupuncturist, like, do you think anything's going to improve here or not? They were like, where'd you get this report from? This is unreal. I have never seen anything like this. It went in such depth and detail, which is saying, looking at a EKG and having it give you information about potentially liver disease, that's mind-blowing.
That's right. That's right. Now, I will say the large language models, interesting, challenging area right now. They can be really good.
Or really bad.
Or really bad. But by and large, if you ask most people about any profession, whether I ask questions about like banking or the auto body shop, right? Like, what should the auto body guy do for my car? Like, I will pre-look that up, and he is like, oh gosh, darn it. Like, did you this is my job. Like, I do this, you go do your heart tinkering and like, let me do this. But when you're curious, you do that, right? We all do it for all sorts of fields. The problem is what the AI is doing in the ChatGPT kind of OpenAI, Claude, Perplexity, you name it, whatever Grok you're using. It's looking at word relationships that are out there, kind of in the universe, and it's pulling all those together. And increasingly, you have some that are saying, hey, I'm only going to pull the word relationships in the health and medical industry, so we kind of have a specialty. And I would be surprised if other industries don't have like, an elevator specialty thing, right? So that if you're going to, because you don't want stuff that's not about that in that if you're looking for like, how do I fix this? As we do that work and we're pulling words and trying to put things together, and we're trying to kind of like justify that, right?
Mhm.
The problem that arises is it's pretty good up front. It doesn't know your specific context. It doesn't understand nuance of what else is going on in your life, in your health today. And it has not seen edge cases, because AI actually works by saying, what is the most common association that I see? I will put those things first. That's why it's right so much of the time. It says, these are the four most common things. And you're like, oh my God, those are the four most common things. The problem is when you have thing number 9, AI is unlikely to find it at the current day without a whole lot of good prompting by someone with a ton of intelligence about that topic, working with AI. And so it goes back to this phrase that I've been using since the beginning, which is collaborative intelligence, which is we really want to make sure that we as clinicians are working with the AI to ensure that's doing the right thing. So if there are any, actually, not even doctors or nurses, anybody who's listening who has a specialty that they're really good at, I would say go to your most common LLM, whatever you use, and just break it. Keep asking questions. Like, you should ask questions about leadership until it gets something wrong, until it creates fake words.
And you can do that.
You can do it. You can do it, you know? And so there's definitely patient agency and empowerment by using this and making yourself somewhat knowledgeable. What I tell people is, don't ever ask for information without a source. So if you're going to put, by the way, I would say don't put your health information in these things, even though you think you're taking out all the personal data. I think it knows more than we do. Just my opinion. But we've all done it, right? Like people have all done it. So having said that, I think when we do it, to really say, show me the source. And then you'll be like, oh, Auntie Jane's read it. And you're like, okay. Like their sensory neural hearing loss, according to Auntie Jane, is like not what you're looking for, right? But then you say, oh, look, this is a Nature journal, right? Which is a
okay. You just leveled AI better than I've ever heard anyone do it.
But you know, I think this is it. This is what we're dealing with, and it's great to use it when it works and it helps a little bit. But you got to work with it. You cannot assume it's right. You shouldn't assume it's totally wrong if you need the help, right? And so I think this is where we're changing with the times, you know, which we've done before. Like I grew up writing on a typewriter, like, so, you know, yeah, there we go. Yeah.
I can still type the quick brown fox jumped over the lazy dog's fence.
Why did we learn that? Oh my goodness. Yes.
We got all the letters in.
Right.
But where do you see you're in the FDA, and I've worked with biotech, pharma, and medical device companies for over 30 years.
Yeah.
And they get to that FDA process. Where are you seeing, we don't have to name companies or anything, but where do you see the clusters of the most interesting innovation coming from in that area? And where the breakthroughs might happen?
Yeah. So a few things. One is, I think the drug and device development area is so interesting. Like we put so much money and take so long to learn about relationships. And for hypothesis generation, like AI is really good at being like, look at all these connections. Any of these make sense to you? And then you kind of work with it. And then so I think that whole curiosity, finding new things era, like I think that's going to be really interesting in new drug development, new device development. It's not anywhere near prime time where we're going to be necessarily having that, you know, in our hands right now. But I think that area is really interesting. The other area where I'm interested to see what happens is so ARPA-H, which is kind of a government funding organization, has just put out this thing called the Advocate Program. And the idea is they want to see in cardio, kidney, metabolic, right, the things we do, can you build AI agents? So if you're at home and you notice that your blood pressure is up a little bit, can I build a closed loop system that says, hey, Dan, your blood pressure is up a little bit. According to guidelines, this is the right thing. According to all of your information, this would be a safe thing to do. And so we're going to do that for you. That last part terrifies me. I will say it again and again. that last part, like, we're going to do it for you. I'm like, oh, wait, you're not going to have a human check that last step. But the whole point is there are millions of people not getting access to care at all, not getting adequate access to care. Seeing your doctor twice a year to see if you have hypertension is silly. You should know it every single day, and we should be working with it. And so in order to really achieve population health, we do need to study AI. And so I think what we call that, which is agentic AI, right? Or kind of, I think that area is really interesting. And then yesterday, I was on the phone with a company that does AI phone calls to patients after they leave the hospital. And there's no confusion. They very clearly say, I'm an AI, right? I want to ask you some questions. Are you okay with that? You can say yes or no. You could say, I want a human, fine. And then they actually kind of then go on and have all of the knowledge of what happens after discharge available to them, because it's not just a large language model that's pulling from the web. We've fed it with the exact information we want it to know, and it does not pull anything else, right? And so now it knows exactly what to ask, where to go next. We've tested it against nurses. It turns out humans actually don't do as well as AI does when it's a well-trained AI, because they probably also have all the knowledge, right? You don't have to go search for it. It's just there in the AI. They have the time, the patience, they can slow it down. They can do multiple languages. They can turn it to an 8th grade language. They can turn it to a 3rd grade language. They can wait and come back and remember exactly where we were. I mean, how many times do you and I stop a conversation and like not remember where we were 45 minutes later? But these things can stop and remember everything from the last minute. Exactly. But these things can stop and come back to that conversation. So you can say, hey, I got to go pick up my kid and come back. Can we keep talking about my discharge? And actually that AI is going to be able to remember the entire conversation in better depth than you. They can review it for you and say, here's what we talked about before. Where do you want to pick up, Dr. Bhatt, about your health? And so I really think the voice AI paired with really smart knowledge, tested appropriately against and with clinicians, and always with a way out. Always with a way to rescue, right? Always with a way to kind of up titrate, whatever you want to call it, and kind of get to somebody. I think that's really promising too. And I think we're really going to all get used to that. I mean, we're used to Alexa and, Hey Google and whatever else is happening in our house. So I think we're going to get used to that. So those 3 areas, the drug development, the discovery, I think this agentic systems, and can we get to population health? And then this other idea. And then the last thing I'll mention that I have no knowledge about is the robots. They're so cool. I don't know. Did you see the dancing robots? I mean, these things are.
I'm just trying to figure out if that was AI or if that was actually real.
I mean, I think this was real, but sometimes it's hard to tell. But what I will tell you is what I do know is real is, so these were for people who may not have seen it, right, with the Olympics, right? So dancing kind of robots, like really doing incredible stuff and flips and all coordinated. But at the University of Maryland, there's actually a group, and I know the students there are studying how to make robots able to do more small movements. And so they're using the Indian kind of dance of Bharatanatyam. It's a traditional Indian dance where they have different hand symbols that you'll make. And they're teaching those hand symbols to the robot to create manual dexterity so that robots can do intricate things. You can imagine in healthcare, you have got to have manual dexterity and be able to do intricate things to help a surgeon in the OR, et cetera, whatever. So I'm not saying that's coming now, but I thought it was so interesting, 1, that robots are learning these things, and then 2, that we're using art and culture to teach. And I love seeing that. I just feel like there must be something for the greater human good that is good about when art and technology actually travel together.
It's so interesting that you just said that, because you triggered another question. You mentioned earlier, closer to the beginning of this interview, that there are less cardiologists coming into the field. And with an aging population, particularly in the United States, obviously that's going to create some kind of gap. And some of the things you see about AI, they're like, well, certain traditional jobs are just going to get taken over by AI, but creativity is going to go elevate in new ways that haven't been seen. I'm curious tying that all together, why do you think less people are going into medicine, particularly for cardiology, with an aging population? And what would you say to someone who's thinking about?
Yeah, we talk about this a lot kind of globally in cardiology. And, one thing is if you just kind of look at people coming in, there's, just STEM, start from the beginning, enough STEM exposure, right? And especially for girls, by the way, right? Like enough STEM exposure. And then kind of the barrier getting through college, how long and sometimes expensive it is to get through med school. And, kudos to places like NYU that are making it free for people to do good, right? And then the course after that, you have to actually trade in internal medicine or pediatrics first, and then cardiology, and then so, I was 32, 35, I don't remember now, but I was older when I was finished training because of all those years. My friends had been in the workforce in investment banking for like 10 years, right, by then. I think the other thing is we really need to capture the imagination of people better. We talk a lot about like, hey, I was good in science and I liked people, so I did medicine, right? And I always tell people now because I've really thought about this a lot. I like medicine because there is no other occupation in the world where within 2 minutes of meeting someone, you know everything about their life. They trust you. Like that intensity of relationship, you can't find anywhere else. And I love that. You can ask my friends. Like I will be best friends with the person next to me at the bar if they give me an opening, right? Like it doesn't matter. And so, as you can tell, like I enjoy thinking with people. And so that is why I love medicine. I think sometimes we don't stop long enough, medicine in general, to really tell people about the art of medicine, right? The humanity of medicine, the creativity of medicine, because that's why we're there, right? I'm not there to type up notes. By the way, AI is taking that away. I can now talk to you and then it's recorded and then my notes pre-written. Right? So, that's all. It's all bringing me back.
That's a huge benefit.
Huge benefit, bringing me back to being with my patient, which is great. But I think that's the part that's, the logistic things our audience can kind of look up, right? The drop in numbers each time. You have to go another level. The length, and people are trying to shorten the duration of training. But I think it's that art of medicine that we need to learn to kind of express better. I will say something else, though, since we're talking about AI. There's a real opportunity globally and here in the US, rural America, et cetera, to take the people who really aren't getting great care and don't have access to care, right, and are increasing in number, and the decreasing physician and nurse workforce. We have not mentioned pharmacists, LPNs, community health workers, the use of doulas and midwives. Like there are so many other practitioners and people who are really touching people and live in the communities where these people live are in fact accessible. And so the more we can expand our concept of who is our clinical workforce, the more care we're going to offer. And if we can use AI to, let's say, upskill a little bit, right? You put in your information, you learned something about sensory neural hearing loss. Imagine if this is a nurse who at some point had learned something, right? Or a pharmacist who works on, just think of how you can upskill people in a specific area, not to offer the exquisite care of 35 years of training, but to at least triage and say, I think you're sick. I think you're okay. Right? Like they should be able to do that. And how great would they feel about being in the community and being considered part of that overarching system? So upskilling people to deliver care in the community, huge potential benefit of AI.
You are so perfect for your role as the chair of the FDA Digital Health Advisory Committee. If you're listening out there, you should know this is an expert. And I also love that you said the art of medicine. You don't hear that phrase often. Yeah. You hear the practice of medicine, but the art of medicine is a really great phrase because there is tremendous creativity. If someone's ever been sick, or been a caregiver to someone who's sick, the doctors as you said, that intimate connection with that, when that intimate connection builds, like I had when I would go with my mother when she was sick to different doctors, one of whose name was Amy Bhatt.
Oh my goodness. There's a lot of us. It's a surprisingly common, name.
So right away, your name holds near and dear because we love Dr. Bhatt. But, that bond that develops and the interesting art of questioning.
Mhm.
You know why they talk about the Socratic method of questioning and delving and trying to get that little extra bit of information from that patient. It really
Mhm.
is an art, and it doesn't get called that often enough. And I think that's a wonderful takeaway.
Well, the concept makes me smile because it's really why many of us went into medicine in the first place.
hmm
Yeah.
Now, what would you say to somebody who's working in any AI right now? Where are some other things you would like them to be bringing to you as something that they say, we want you to look at this for approval and so we can get it into the market? Do you have any things you envision that you wish you were seeing?
Oh, that is a great question. Um,
Maybe
I
it's not a fair one yet.
No, 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 no. I am waiting for someone to come to me and say, hey, I can reasonably pull together for you the relationship between the various social factors going on with this person and the medical factors, and then their wants, right? Like what they want from life.
Huge.
It's
Now
not,
you're into the blue zones and the idea of
that's
you know,
that's it.
society and culture and belonging.
I want to bring that in. I think it is so important. If you look at the rates of kind of mental health disease, especially anxiety and depression, people with cardiac disease, it's significant. We don't necessarily know how to address them together. If you look at why we don't always have people on the right meds at the right time, it's not because they don't believe in the med. Sometimes it's because we can't pay for it, but other times it's just it didn't fit into like life,
Mm-hmm.
right? And so how do we make that happen? And so I think that's what I would want is people who can take differing data sets, especially the ones that are about what a human wants, and put that into how we deliver health. Now, in some forms of medicine, like your appendix burst, it needs to come out. It may not matter as much what you want and what you're, so we have to do it. So there's like urgent care. But for chronic disease management,
Mm-hmm.
I would love the process of having a chronic disease to be not such a negative, because most of us are going to have one.
Have
So
you read the book, The Heart Math Solution?
the what?
The Heart Math Solution.
No, I'm going to go look it up.
Will love it. It
Okay.
came out, a girlfriend gave it to me when I was having a very severe heart issue after September 11th.
Oh.
And it showed up about 4 years later. And she said to me, it's all cleared up, all cleared up.
Goodness.
Walking a lot.
Good.
I rebooted my rhythm.
Good.
In the book, she gave it to me, which was interesting because I was stressed. 2 little kids home, married, 2 little kids, running a very big business that was mine. And she said, you might want to read this book. And it was about Doc Childre. And he basically talked about how people, he was, I believe, a cardiologist and also a psychologist, and talked about somewhat what you're saying, the like how people use phrases, this is breaking my heart.
Mm-hmm. Mm-hmm. Amazing.
Oh, this is killing me.
Yep.
You're making the words people would say that were heart related.
Yes.
And he was breaking down conversations he was having with his patients.
Amazing.
And what they were saying and how it was aligning with their EKGs and things.
Yep. Yep. So interesting thing about EKG, it can actually tell you your age in a way, like how old you seem. And when you're stressed, your EKG suggests that you're 8 years, 16 years older than your current age in that moment. And then it can come back down when you calm down. I mean, if that's not like heart, brain, soul connection, I kind of don't know what is,
Oh, I agree. I agree. Oh my gosh, I could keep talking to you for hours, but you're going to laugh about this. Many of the very avid followers of this podcast just said to me, Diane, this year, do you think you could bring it down to closer to about 45 minutes? Because my workouts, I'm making them a little shorter this year. I used to go on the treadmill for an hour.
I love it. But that's people actually telling you when they're listening to you and wanting to kind of engage in the same way. I love that. That's actually really good because awkwardly my battery level is at 4 and my charger's not working right now. So like I was getting nervous and so this is it was meant to happen. But it's funny. We do a leadership course at MGH. It's called the MGH Elevate Leadership Course, and it's for people at a chief or kind of assistant chief level. And the idea is, we used to say, oh, how do you lead in times of change? And now we realize change is constant in medicine. How we deliver care is changing rapidly, right? Technology and AI are constantly changing. It's not just there is AI, it's AI is changing and we're trying to figure out how to do it. And so we really spend a lot of time thinking about how do you lead people as the world is continually changing. And I was at a few weeks ago, I do kind of executive briefings for companies and stuff where we talk about where does AI affect healthcare. And somebody actually mentioned to me during one of those meetings, they said, I wish we would listen more to the customers that we are serving and then take that information, feed it to our AI and figure out what to do. And so you don't even need that, Diane. You're just listening to your customers and you're like, I've got this. I'm going to stop at 45 minutes because they say so. But again, I think it was similar to this idea that I have of I want to know what socially is going on with my patients, not just medically, or you want to be able to, deliver the kind of podcast that they want, is this idea that now what AI enables is for us to really personalize not only our healthcare to our numbers, but our experience of how do we want to think about health. And if the experience of healthcare matches you, you're more likely to participate. And that gets back to where we started. Why aren't enough people paying attention to their heart health? Well, maybe we're just not engaging them in the right way. And I think this is an opportunity to do so.
Dr. Bhatt, you are one special person. You are an asset to this country, and what you're sharing and teaching, oh my gosh, it's got to be a complete delight for someone to sit in front of you and engage with you on different levels with what they're trying to develop and learn and do and how you teach. Really, this has been a great interview.
Thank you.
Oops, we may have lost battery there. So I am signing out. I'm Dian Griesel, also known as Silver Disobedience. This has been the Silver Disobedience Perception Dynamics podcast. I'd like to encourage you to subscribe and share this episode with your friends. Thank you.